2022. Whereas Pennsylvania recognizes the month of May as Mental Health and Trauma Awareness Month and May 25th to be Trauma Awareness Day in the Commonwealth, and whereas the term Adverse Childhood Experiences, ACEs, describe 10 categories of adversities in 3 domains experienced by age 18 years: abuse, neglect, and/or household dysfunction, and ACEs are negative life events or experiences that occur before the age of 18. The number of ACEs is strongly connected to the risk of health problems in adults, including chronic diseases, mental health problems, substance use, and other risky behaviors. And whereas 1 in 8 Pennsylvania adults report having experienced 4 or more such traumatic experience during childhood, including, sadly, many citizens of Lancaster County. And whereas there is substantial evidence that promoting safe, stable, and nurturing relationships can be effective in reducing child maltreatment, and we in Lancaster County are always interested in promoting strong, stable families and healthy children here. And whereas research has shown that prevention of prolonged exposure to toxic stress, early intervention, trauma-specific treatment, and building resilience of children and families can mitigate the impact of trauma. And whereas Trauma Awareness Month promotes awareness of the impact of trauma and its effects and promotes resiliency in families and communities. And whereas over 7,000 Lancaster County residents have completed trauma awareness education, and more than 50 organizations, including social services, healthcare, law enforcement, education, and housing, have been involved in working groups, planning, and delivering trainings. Now, therefore, be it resolved that Lancaster County, the County of Lancaster, recognizes May to be Mental Health and Trauma Awareness Month and May 25th to be Trauma Awareness Day, and encourage citizens to be part of the solution to prevent and address trauma, especially among children, and to support strong, healthy families in Lancaster County. Ray Extingo, Chairman; Josh Parsons, Vice Chairman; John Trescott, the Board of Commissioners of Lancaster County.
Thank you. We have several members of the Kennedy of America and the Kennedy Executive Director of Touchstone Foundation, Susan Billy, Manager of Behavioral Health Support Services for Lancaster-Lebanon IU 13, Debbie Gable, Vice President of Resident Services, HTC MidAtlantic, and our own Judy Erb, Executive Director of BHDS, and Julie Holtree, Deputy Director of BHDS. Welcome you to come on up and make some comments.
All right, thank you. Thank you, Commissioners.
Alice.
Hi, good morning. A special thank you for proclaiming the importance of mental health, mental well-being, not only to most of the citizens in Lancaster County, but to the economic vitality of the community, as well as what the mental health effect could have on how we create our community. So thank you so much for doing that. I have just a few data points I'd like to add to the proclamation, and then we have lots of members of the Let's Talk Coalition that have really contributed to sort of addressing the issues related to mental well-being in the county. The data that we have that's most recent goes back to 2018 and 2020. New data should be coming out shortly. So I think one thing we can acknowledge with the mental health crisis and then with the pandemic is that, you know, some of this data straddles the years when we had the pandemic, and I think we all recognize the mental toll it has taken on adults and youth in our community during the pandemic. So we're interested in seeing the new data that comes out to really get a sense of, as much as we can quantify, what mental well-being in the pandemic has done during this time. So we feel like there's a lot more work to be done now. I think we're on a wonderful path with partners, which we went into the pandemic really strong, working together, because this issue is no issue that one organization can take on by itself. So what we have for the adults data goes back to between 2018 and 2020 aggregated data from that time, and that shows that nearly 1 in 3 adults in Lancaster County report that they've experienced 1 or more days in the past month where their health was not good. And again, that is kind of just pre-pandemic or the beginnings of the pandemic there. For youth, it's a little bit more frightening. The data that we have available right now is 2019, so it's pre-pandemic. The data for youth should be coming out any day now. I just made a call this morning to see if the data was available, and it wasn't available yet, but it should come out any time now. So 37% of youth felt sad or depressed most days in the past 12 months, and 24% sometimes felt that life is not worth it. And this is 2019, and so 2020 data should be coming out any day now. So it's really, really scary information from our youth at this point in time. However, the good news is in 2014, Lancaster County's physical and mental health providers came together to sort of think about what it is we need to do and did a strategic planning session. And from that time on, have come together to look at evidence-based practices and solutions on what it is we need to do to improve mental well-being in our community, with lots of quantifiable and quantifiable data and some improvements that we've measured over time. I won't go into all of that, but I think some of you know me, particularly Commissioner Parsons, and some of the work that we've been doing with Joining Forces, and we have lots of data to start tracking what it is we're doing. But most recently, this coalition continues to come together to improve mental well-being in Lancaster County, and particularly look at advancing practices and policies related to trauma-informed care. We do have a significant road ahead of us, but because this coalition, I feel confident, and I think many people in our coalition feel stronger because we have a history of working together. Some of the main things that we focused on is reducing stigma. I think the biggest thing that has happened over the past several years is that we took our heads out of the sand and felt that we need to talk about this, that there's people in our families, if not ourselves, that have experienced some level of anxiety, depression, and stress at some point in time. And the most important thing we could probably do is to talk about it. So there you go, the name of the coalition, Let's Talk Lancaster, and that's how that all came about. So I'd like to move on and have some of the our other partners within the coalition to come up and talk specifically, just for a brief period of time, about the specific work that their organization is doing related to mental well-being. Kim?
Thank you.
Yeah.
Good morning, everyone. I am honored to join my fellow partners in the work of mental health and trauma-informed care. I have a picture here. This is the mental health bell. It is a symbol of hope. During the early days of mental health treatment, asylums often restrained people who had mental illnesses with iron chains and shackles around their ankles and wrists. With better understanding and treatments, the cruel practice eventually stopped. In the 50s, Mental Health America issued a call to asylums across the country for their discarded chains and shackles. They were melted down and recast as a symbol of hope, and that is the mental health bell. Today, the mental health bell serves as a constant reminder of hope and optimism for improving mental health and achieving victory over mental illnesses. The data reflects alarming rates of impact that mental health has on our community. 22% of our population experienced mental illness in the past year. 20.8% of people experiencing homelessness in the U.S. have a serious mental health condition. 37% of adults incarcerated in the prison system have a diagnosed mental illness. People with mental illness die 15 to 30 years earlier than the rest of the population. We can improve the statistics because mental health is a treatable illness. In Lancaster County, mental health has been identified as one of the top priorities in the community health needs assessment. We strive to create a community that supports mental wellness by increasing access to treatment, educating ourselves and our community members that mental wellness and supporting our fellow citizens as they seek to improve their mental health. We are committed to doing this through our transformative partners who are here today and collaborations, some which are not here today. And we have this mental health bell as a reminder of how far we can go together. Thank you.
Good morning, Commissioners,
Good morning.
guests. I'm Anna Kennedy, Executive Director of the Touchstone Foundation, Youth Mental Wellness Partners for Lancaster County. Our work focuses on increasing access for youth mental wellness and improving workforce development for our mental health providers here in Lancaster County. So, even before the COVID-19 pandemic started, mental health challenges were the leading cause of disability and poor life outcomes in young people, with up to 1 in 5 children ages 3 to 17 in the U.S. having a mental, emotional, developmental, or behavioral disorder. Unfortunately, in recent years, national surveys of youth have shown major increases in certain mental health symptoms, including depression and thoughts of suicide. The National Center for Health Statistics estimates that there were tragically more than 6,600 deaths by suicide among youth ages 10 to 24 in 2020. The COVID-19 pandemic has added to these challenges facing America's youth today. The pandemic's negative impacts most heavily affected those youth experiencing trauma from adverse childhood experiences. Depression is the #1 risk factor for suicide by teens. Depression is a risk amplified in teens self-medicating with drugs and alcohol. For youth between the ages of 10 and 24, suicide is the 3rd leading cause of death nationwide. And each year, approximately 157,000 youth between the ages of 10 and 24 receive medical care for self-inflicted injuries at emergency departments across the United States. So I'm going to translate this a little bit into Lancaster County data for you. So here in Lancaster County, 32% of high school students reported feeling depressed in 2021, and that's from the PA Youth Survey data, preliminary data that's just coming out. That means approximately 7,924 students in high school here in Lancaster County reported symptoms of depression last year. And 20% of high school students here in Lancaster County reported that they've seriously considered suicide in the last year. That's an estimated 4,952 Lancaster County teens. So these are alarming statistics, and we're all here today because we know that we can save these kids' lives. So our kids need our help, and together we can help them. So thank you.
Thank
Good morning, Commissioners.
Good morning.
My name is Susan Billy, and I'm from the Lancaster-Lebanon IU13. Our focus is on children birth to whatever age here in Lancaster and Lebanon counties. But my thoughts here are focused on Lancaster County. But big picture, the U.S. Surgeon General reports that 1 in 5 children ages 3 to 17 will be diagnosed with a mental health or behavioral health disorder, and only 20% of those diagnosed will actually receive treatment. As Anna mentioned, the Pennsylvania Youth Survey from 2021, the preliminary data, it does reflect that 27% of the 6th graders, 31% of the 8th and 10th graders, and 34% of the 12th grade students that completed that survey reflected that they've been feeling so sad or helpless over the course of the last 12 months that it has caused them to really remove themselves from some of their regularly enjoyable activities. In Pennsylvania, the Pennsylvania Public School Code requires all school districts to have a student assistance program in place for students K through 12. And this is a team process that is used to mobilize resources to identify when there are mental health concerns or maybe substance use concerns, any other barrier to students' academic success. In the 2021 school year, 2,400 students in Lancaster County were referred to that student assistance program within their respective school district. And the primary referral reasons during this past school year include internalizing behaviors, which could things that result from trauma, from ACEs, from other mental health concerns. Externalizing behaviors was the second most highest referral reason. And then family concerns, which could, again, be response to trauma. It could be a result of ACEs that Alice mentioned. It could be substance use disorders, any variety of reasons. And the school's responses to those primary referral reasons include one-on-one follow-up with either a SAP team member or another school staff member, a group intervention for maybe skill building or social supports, and then one-to-one counseling with either a school counselor or a school psychologist. But that's about 1,200 students across the county that that are identified as having those needed supports. And I would like to just bring your attention to some of the things that our schools are doing despite really heavy caseloads. Our student assistance programs are working very hard to meet the needs of our students by connecting them with services either within the school or within the community. However, the staff are overwhelmed because of the volume of students that are presenting with these challenges. Trauma-sensitive education and mental health awareness is being presented to our school staff. Some districts are even adopting a trauma-sensitive approach across all aspects of their operations. Mental health awareness is being provided to students. It's not consistent in all schools. However, this does include in-service to our students on suicide awareness, bullying awareness, and behavioral health awareness, classroom lessons, and curriculum focused on student well-being and social skills. Many of our school districts are utilizing universal screening. However, that's only being done in certain grades. And once those universal screenings are conducted, we're faced with a barrier that we have a volume of students that really need to be connected with services, and our systems are overloaded, and therefore wait lists are quite extensive, and our students are not receiving timely services. School counselors and school psychologists are doing their very best to try and support our students. The recommended national standards for school counselors is 1 school counselor to 250 students. In Lancaster County, that ranges from 1 counselor to 214 students and upwards to 536 students. Recommended national standards for school psychologists is 1 school psychologist to 500 students. We don't have the data available for Lancaster County, but in Pennsylvania, our data reflects we have 1 school psychologist to 1,078 students. Our school districts are looking to try to utilize the American Rescue Plan and the ESSER funds to try and bring some mitigation to the needs of their students. However, those funds are not long-term, and therefore school districts are looking at how can we sustain the services and the supports in-house that our students do need. So we're doing everything that we can. We have a lot of work that we need to continue to do, and we have a lot of supports that we continue to need. So I appreciate your time this morning. Thank you.
Thank you.
Morning, Commissioners.
Good morning.
My name is Debbie Gable. I'm the Vice President of Resident Services with HDC MidAtlantic. And I just want to thank you so much for having me here today to speak about the work of trauma-informed organizations in housing. Community residents who live in trauma-affected neighborhoods deal with instability and isolation of poverty on a daily basis. The experience of historical disinvestment, trauma, and concentrated poverty can result in disempowerment and diminish a community's sense of ownership. Residents may have had negative relationships and experiences with service providers or public agencies, and they may harbor resentment or feel disinterested in investing in their communities. I want to take a little time to just highlight some of the strategies that really try to overcome some of these challenges and support mental wellness and apply trauma-informed principles to community work. Some of these strategies are to meet residents where they are, to do everything we can to eliminate barriers to participating and making activities open and inclusive. Creating environments that are welcoming, safe, and accepting so that residents can have positive experiences with their fellow community members. Creating visible and accessible opportunities for participation that allow residents to be involved in decision-making and to experience the tangible benefits or results of positive community change. And developing and implementing a long-term vision and community-wide strategy for addressing trauma, rebuilding relationships, and advancing justice, equity, and health in the community. At HDC MidAtlantic, our vision is a world where a safe, welcoming, affordable place to call home is open to everyone. When individuals and families live in a safe, affordable home, they can move from surviving to thriving. They can feel optimistic about their future and access opportunities to act upon their dreams and bring joy to their lives. We support and advocate for our residents and connect them to resources, opportunities, and services that promote economic mobility, support mental health and well-being, build resident leadership and a sense of community, and strengthen a sense of personal agency. I'm honored to be here today with all of you, with my community partners, together to make Lancaster County a place where people can feel supported in their journeys toward mental health and well-being. Thank you.
Thank you.
Good morning, Commissioners.
Good morning.
For everybody, I am Judy Erb. I'm the Executive Director for Lancaster County Behavioral Health and Developmental Services, and this is an agency that has 3 departments, and the largest of which is responsible for mental health services, including crisis intervention. So I echo my colleagues here in expressing thanks for taking the time to recognize mental health and trauma awareness. And I also want to do a shout out to those folks that are currently working in the field to provide the help, support, and treatment to the children and families individuals impacted by these issues. It's been a difficult few years for those of us in the trenches. I wrestled with what to say about this topic for mental health awareness, knowing I had a brief period of time. And I could echo and regale more statistics, but you could all do the Google and search those on your own. And I did find it interesting. We all came prepared to have numbers and data for you because data is important. And I do recognize that. And I looked at two stats that I thought might serve to illustrate and bring home what we're actually talking about and how this is so prevalent in Lancaster County, the issue of mental health. My statistics came from the National Alliance on Mental Illness, and they're from 2020. And the first is that 1 in 5 adults in the U.S. experience mental illness. 1, 2, 3, 4, 5. Alice has 1 in 3 in Lancaster County will experience mental illness. The second is that 1 in 20 adults in the U.S. experience a serious mental illness, which is major depression or a psychotic disorder. And we could start counting around the room, but I won't do that. The point is, it's here in this room, it's prevalent. And if you look at the statistics for Lancaster County, we have 549,000 as a population. Approximately 413,000 are adults. I am not a mathematician. I couldn't do the math on this, but it just tells me that using the 1 in 5 or 1 in 3 numbers or the 1 in 20 numbers tells us that there are tens of thousands of adults here in Lancaster County that at some point will need the use of mental health services. So what does this mean for us? At last week's Mental Health America's Legislative Breakfast, the keynote speaker, William Z., an attorney here in the city, spoke about his personal trauma and his own mental health journey. He used a reference from World War II, and I'm a history buff, and so it resonated with me, and I'm liberally stealing it from him. He talked about Dunkirk and how the Allies were faced with a seemingly impossible task of rescuing soldiers from the beaches and harbor while being surrounded by German troops. And yet, despite the odds, the soldiers were evacuated. Why? How? Because ordinary people brought their boats. They brought their yachts, their fishing boats, their pleasure crafts, their lifeboats, and they sailed the soldiers to safety. So I challenge all of us to bring our boats to those individuals in Lancaster County living with mental health needs, issues, concerns. Bring our boats of education and training to reduce the stigma and increase awareness. Bring our boats of clinical experience and knowledge to provide treatment. And most of all, bring our boats of advocacy to our legislators so that they can ensure that funding is at an adequate level to support the necessary services and resources for our individuals here in Lancaster County. Thank you.
Thank you. I'll ask the board if board has any comments.